Welcome back to Chilltalk English. I'm Henry.
And I'm Emma. Hi, everyone.
Today, we have a topic that sounds serious, but it's super useful. We're talking about family health history in English.
Yes, this is the language you might need at a clinic, a hospital, or even when you fill out a health form online.
Also, if you're learning English for work, like nursing, caregiving, or medical reception, this topic comes up a lot.
And don't worry, we'll keep it simple, clear, and friendly. No scary medical lecture.
I'll do my best. I'm not scary, but I can be confusing.
Henry, you are confusing in a cute way.
Thanks, I think. So, what does family health history mean?
It means health problems that happen to people in your family, like your parents, grandparents, brothers, sisters, or other relatives.
Doctors ask about this because some health problems can be more common in families.
Exactly. Not always, but sometimes, and the doctor wants a clearer picture.
Today, we'll do three things.
First, we'll give you the most important questions you will hear in English.
Second, we'll share useful answers patients can give.
Third, we'll talk about common mistakes English learners make and how to fix them.
And we'll do some mini role play because hearing the phrases in a conversation helps you remember them.
Let's go.
Imagine you're at a clinic. A doctor, a nurse, or a staff member may ask a general question like this. Do you have any family history of...
This is a top phrase, very common.
Here are a few more natural ways to ask the same thing. Has anyone in your family ever had... Has anyone in your family been diagnosed with? Does anyone in your family have...
Nice. Let's make them even easier. Have is simple. Diagnosed with is a little more advanced, but it's very common in medical English.
If you hear diagnosed with, it means a doctor officially said the person has that condition.
Good. Now let's give examples.
Has anyone in your family ever had diabetes?
Has anyone in your family been diagnosed with high blood pressure?
Does anyone in your family have asthma?
And notice the time words ever is useful. It means at any time in the past.
Now, learners often ask, what health problems should I learn first?
Great question. The most common ones are diabetes, high blood pressure, heart disease, stroke, cancer, asthma, and sometimes mental health conditions like depression.
You don't need to memorize everything today, but learning the question patterns is powerful. You can use them for many topics.
Let's do a short role play.
Okay, I will be the nervous patient.
That's not acting, that's real life.
True.
Do you have any family history of heart disease?
I'm not sure. My grandpa had some heart problem, I think.
Okay, thank you. Which side of your family? Your mom's side or your dad's side?
My dad's side. It was my dad's father.
Got it. Do you know how old he was when it happened?
Maybe in his 60s?
That's helpful. Thank you.
That question Emma asked is extremely useful. Your mom's side or your dad's side?
Yes, because many people remember it like that.
In more formal medical words, mom's side is maternal and dad's side is paternal.
But with patients, you can keep it simple. Mom's side, dad's side. Easy and clear.
Let's practice those phrases in full questions. Is that on your mom's side or your dad's side?
Was that your mom's mother or your dad's mother?
That can help you understand if it was a grandmother on one side or the other.
Now, let's talk about a very natural phrase. It runs in my family.
Ah, yes, that phrase is everywhere.
If something runs in the family, it means many people in the family have it.
Like, high blood pressure runs in my family.
Exactly. Let's give a few more examples. Diabetes runs in my family. Migraine headaches run in my family.
Allergies run in my family.
Nice.
But here's an important detail. In English, we usually say, it runs in my family, not it runs in my families.
Yes, let's talk about that common mistake.
Mistake number 1, saying families when you mean one family.
If you're talking about one person, we usually say family, singular.
Correct examples. Do you have a history of this in your family?
Does anyone in your family have this?
If you want to be more specific, say, do you have relatives with this condition?
Or, do any family members have this?
Mistake number 2, saying histories too much.
In this topic, history is usually singular, family history,
So we say, a family history of cancer.
not many family histories of cancer.
Right. If you want to express a lot, you can say, a strong family history of.
That's a great phrase. Strong means many relatives have it, or it happens often in the family.
Example, he has a strong family history of diabetes.
And you might also hear a weak family history, meaning not many relatives, or not clear.
Now, another key phrase is immediate family.
Immediate family usually means your closest family, parents, brothers, sisters, and children.
Sometimes a clinic form will say, any health problems in your immediate family?
If you want to ask it clearly, you can say, any health problems in your parents or siblings?
That's very clear and beginner-friendly.
Now, what about other relatives?
Good point. We often say relatives for extended family, grandparents, aunts, uncles, cousins.
Let's give a helpful line. Any health problems in your relatives, like grandparents, aunts, or uncles?
Great.
Now, let's do another role play. This time, Henry is the clinic worker, and I am the patient.
Oh no, responsibility. Sigh.
You can do it. Calm voice.
I'll try. Do you have any family history of diabetes?
Yes, my mother has diabetes, and my uncle has it too.
Okay, is that your mother's brother or your father's brother?
My mother's brother.
Thank you. And does anyone in your immediate family have heart disease?
No, not in my immediate family, but my grandfather had a heart attack.
Got it. Do you know how old he was?
He was about 70.
Got it.
Nice job.
Thank you. I didn't panic too much. Let's pause and highlight something important for learners. Follow-up questions.
Yes, because patients often say things like, I think it was something with the heart.
And the clinic worker needs more details, gently and politely.
Here are simple follow-up questions you can use.
Which family member was that?
Do you remember what the condition was called?
How old were they when it happened?
Is it on your mom's side or your dad's side?
Do you know if they take medicine for it?
Great. And always keep your tone kind and calm.
Now, let's talk about a sensitive topic, adoption and non-biological parents.
This is very important because language can hurt people even when you don't mean to.
Exactly. In English, it can be painful to say real mom or real dad.
Because an adoptive parent is real. A step-parent can be real in the emotional sense, too.
So what should you say if you mean genetics?
The safest, most respectful word is biological.
Yes, biological mother, biological father, biological parents.
And you can ask gently, like this. Do you know your biological family's health history?
Or, do you know any health history from your biological mother or father?
Perfect.
Let's do a small example.
Okay.
Do you know your family medical history?
I'm adopted, so I don't know my biological family history.
Thank you for telling me.
That's okay. We can still take care of you.
That line is gold.
It's true, and it helps the patient feel safe.
Let's give learners a few supportive sentences to use. That's okay. Thanks for letting me know. We can continue without that information.
We'll focus on your symptoms and your health today.
Very kind, very professional.
Now, another phrase you might hear is genetic risk or genetic predisposition.
Predisposition is a bigger word, but you may see it in articles or hear it in videos.
It basically means you may have a higher chance of a condition because of your genes.
For B1, B2 learners, you can also say, it may be genetic. It might run in the family.
Those are simpler and very natural.
Now, quick vocabulary check. Henry, what's the difference between condition and disease?
A disease is a specific illness. Condition is broader and softer. It can mean many health problems.
Great. So, in a conversation, condition is a safe word.
Like, has anyone in your family had this condition?
Perfect.
Let's talk about another phrase, family tree.
You might hear it in everyday English, not only medical English.
A family tree is a picture or chart of your relatives across generations.
In casual speech, someone might say, cancer is common in my family tree.
Or, there are a lot of heart problems in my family tree.
In the clinic, you don't need to say family tree, but it's helpful to understand it.
Now, there's one more phrase that can confuse learners, natural causes.
Yes, if someone says, my grandfather died of natural causes, it usually means he did not die in an accident and it was not violence.
But it doesn't tell you the exact illness.
So, a helpful follow-up question is, do you know what the cause was?
Or, was it a heart problem, cancer, or something else?
Keep it gentle. Some people feel emotional when they talk about death.
True. And some people truly don't know the details.
Let's do one more longer role play, like a real clinic conversation, but still simple.
Okay, let's do it. Thanks for coming in today. I'm going to ask a few health history questions.
Sure.
Do you have any family history of high blood pressure?
Yes, it runs in my family. My dad has it, and my older sister has it.
Okay. Any family history of diabetes?
Not that I know of.
How about asthma or allergies?
I have allergies, and my mom has asthma.
Thanks. And just to confirm, your mom's side or your dad's side for asthma?
My mom's side.
Has anyone in your family ever had a stroke?
My grandmother on my dad's side had a stroke.
Do you know how old she was?
Maybe late 70s?
Okay, thank you. Has anyone in your family been diagnosed with cancer?
Yes, my aunt had breast cancer. She's okay now.
I'm glad to hear that. Thanks for sharing.
No problem. That conversation had a lot of key phrases. Let's review them slowly.
Here are the must-know question starters. Do you have any family history of?
Has anyone in your family ever had?
Has anyone in your family been diagnosed with?
Does it run in your family?
Is that on your mom's side or your dad's side?
Which family member was that?
Now, let's do common learner mistakes. Quick and clear.
Yes, we'll do wrong, then right.
Wrong. Do you have family's history of diabetes?
Right. Do you have a family history of diabetes?
Wrong. Many family histories of heart disease.
Right. A strong family history of heart disease.
Wrong.
My real father had diabetes.
Right. My biological father had diabetes.
Wrong. Diabetes runs in my families.
Right. Diabetes runs in my family. These are small changes, but they make your English sound natural and respectful.
Let's also give learners a few natural, patient answers.
Yes, because many people listen to podcasts to practice speaking too.
Yes, my mother has it.
No, not that I know of.
I'm not sure, but I think my grandfather had it.
It runs in my family.
I don't know my biological family history.
I don't have much information about my dad's side.
And if you're the clinic worker, you can say, "That's okay. Thanks for telling me."
We'll continue with what we know.
One more small tip for pronunciation.
Yes.
Diagnosed is often pronounced like diagnosed, with a Z sound at the end.
And biological is biological.
Take your time. Clarity is more important than speed.
Exactly. Slow English can be excellent English.
Before we finish, let's do a quick practice section.
Repeat after us, everyone. Say it out loud if you can.
Do you have any family history of diabetes?
Has anyone in your family ever had a heart attack?
Does high blood pressure run in your family?
Is that on your mom's side or your dad's side?
Do you know your biological family history?
That's okay. We can continue without that information.
Nice. If you practiced out loud, you're building real speaking muscle.
And if you didn't, that's okay too. Listening helps a lot.
That's it for today's Chill Talk English episode.
If this episode helped you, you can replay it and shadow the lines.
Shadowing means you speak at the same time as the speaker to copy rhythm and pronunciation.
And be kind to yourself. Medical topics can feel stressful. You're doing great.
See you next time.
Bye, everyone.
Bye.